Brilliant, thank you so much. So yes, I'm Brian Fisher. I'm a semi-retired GP in South East London. I'm chair of the Socialist Health Association, proud to be so. And I've been interested in community development and health for a long time. And what I'd like to do is to give you a sort of galloping tour of the concept and the evidence for why community and health is so important. So the important messages to get across are that there is a lot of evidence for this, that contact with other people that's meaningful and constructive helps build confidence and helps people to see themselves as being able to do things for themselves and for others. And that enables people to take much more control over the circumstances of their lives and environment. And I think Fran was really talking to some degree very powerfully about that experience. So if we look at those ideas, particularly of contact and confidence, first of all, and I'm going to try and show what the evidence base for this is and how important it is for people's health. So what we know is that community development, community strengthening, bringing people together and building social networks, which means that the friends, family, pubs, clubs, the links we have with other people, the stronger and deeper those are, that builds resilience in communities. So it, for instance, builds resilience to economic stress, to COVID, it builds better mental health. And linked with that is the concept of enhanced control, so that communities can then negotiate, for instance, with the statutory sector, just as Fran has done. And it gives people the ability to look after themselves better. And there is some evidence that it helps to tackle health inequalities. So those are the sort of ideas that are behind what I'm going to be talking about. And Public Health England is very clear about this. Being connected with other people improves your mental and physical health. And we all know about loneliness as a sort of one element to that. But this is now really quite well established in public health terms. Here is an example. You live longer after a heart attack if you have more emotional support. A very concrete example of how social networks can improve our health. And when you look at many studies together, so this is a meta-analysis of many other studies, and it controls for sex, age, cause of death, there is a hugely increased likelihood of survival for people with stronger social relationships. So this is equivalent to stopping smoking. So these social networks, the way we live in our communities and how we relate to other people, has an enormous impact on our health. We know that there is not just our health, but crime and delinquency are lower in places with stronger social networks, that it's easier to find jobs because there are contacts between people who can share ideas and share information. And one example of a community development approach showed that after a couple of years, people's perception of the area being a good place to live was substantially increased. People looked after each other better, and people felt much more in control over things in their area. So these are the kinds of things that change when you build communities up. And again, Public Health England is very clear that that this kind of community development approach can reduce health inequalities, give people a stronger say, and engage those most at risk of poor health. So if we look now particularly at the concept of control rather than the concept of contact, Marmot, who is the sort of guru about health inequalities, is very clear that our society needs to enable all children, young people and adults to maximize their capabilities and have control over their lives. And at the same time, we must create and develop healthy and sustainable places and communities. And again, Fran gave us a fantastic example of how that can take place. And looking at it in a slightly bigger picture, this is evidence from Wigan, which many of you may know, has changed the way it operates so that it thinks much more about what communities want. It listens to communities. It works in a much more community development asset-based way. And the result of this over some years is very substantial. So when you look at Wigan's outcomes in relation to, well, compared to similar places, it's really quite stunning. So life expectancy is higher, deaths from cancer have decreased, alcohol-related hospital admissions, suicide rate. They're very substantial changes which the council and the public health department there have put down to this new kind of way of working. And the key message is that our health improves if communities can take back control. So it's an issue, a political issue of participatory democracy, that it makes a difference to the way we feel, the way we think, and our health. So it's a link between a bigger picture and the way each individual feels and operates. And financially speaking, it's hugely beneficial as well. So community development, there is a social return on investment of about 1 in 3. So every pound you spend, you get about three pounds back. There are some projects where that ratio appears to be much greater, but on average, we're talking about a 1 in 3 investment. So overall, when I use the word community development, I'll be explaining that in a sec. What it can do at the same time is that statutory services become more responsive, as Fran has discovered. It promotes health protection and community resilience, helps tackle health inequalities. It changes people's individual behavior. Nice guidance has made that clear, and it's a good investment. It's a pretty powerful intervention that we think all places ought to use. So in the NHS, we think primary care networks, we think local authorities ought to reinvest in community development. They used to, but they haven't done for a long time. And this is what we mean by community development. It's a model. There are many different kinds of community development. This is a model that was developed by Hazel Stuteley, who lives and works in Cornwall. She calls it a resident-led partnership. And the idea is that people in a place, in a primary care network, on an estate, they take the lead. And this is almost certainly necessary to have a trained community development worker to start this process off, but not necessarily to continue it. That the residents decide what the issues are that matter to their area, and they then draw in the statutory sector to them and work with them on sorting out the issues that matter to that area. So it's not about...
Sorry, Brian, just to...
Yeah, I'm nearly finished. It's not a matter of public health saying, we know you're fat and you smoke too much, let's talk about it together. This is about the residents defining things for themselves and making change with the statutory sector. These are the kind of changes that have happened. This is Play Park, which when discussed with the council transformed into this. And there are youth activities in Cornwall which led to a dramatic drop in crime, which was seen to be the result of this kind of activity by the police. And of course, there is a political dimension to this, that we know that when you shrink the state at the same time as causing austerity, you kill people, and the evidence for that is now very strong. There are tens of thousands of excess deaths in this country over the last 2 years because of austerity, quite apart from COVID, which is a whole other disaster to talk about. So we think community development is a well-established and well-evidenced intervention that everywhere should look at, particularly Sheffield. So thank you very much for listening.
Great.